which I'm sure you're all very much aware of, is that I'm seeing that in the news. Scott was going to talk about a couple of those items that have to do with Medicare and some of the other issues that are near and dear to our hearts. But what I'm going to go ahead and get started on are the budget matters that are related to the VA. This year we're looking at a overall increase of about 10.5% for the Department of Veterans Affairs. It's a bigger increase, and looks like they're trying to put some money into some more places where we need them. So providing 6.2 billion, that's billion with a B, to quote expand inpatient, residential, and outpatient mental health programs, and that's about 312 million more than they requested last year. Obviously, there's a great and growing need, as we all know, for mental health care within the VA for returning vets from Iraq and Afghanistan, as well as the veterans that are already utilizing VA for mental health systems, such as Vietnam vets and veterans of other generations and other time periods. During the testimony yesterday of the VA hierarchy, if you will, they had the secretary and various undersecretaries testifying before the House Veterans Affairs Subcommittee. They went through this kind of subject by subject, and there were some questions that the members of Congress had for the secretary and for his staff, and they had a little bit of a back and forth. According to Dr. Petzel, Robert Petzel, who's the Undersecretary for Health in the VA, he was quoted as saying that they have hired at least roughly 20,500 mental health personnel within the VA to treat veterans and assist with their treatment of mental health problems. He didn't give a line-by-line breakdown of that population, of what it looked like. He did, however, though, when he was making his statement, say that they've hired psychiatrists, psychologists, and psychiatric social workers. So while we were not specifically mentioned, we don't know how many of those are counting as counselors and how many of those are counting in those other various fields that they all might just lump in together as mental health providers. Some other interesting kind of tidbits on the VA budget is that this year they're going to appropriate $1.35 billion of federal funds towards the department's efforts to end homelessness among American veterans. This is a top priority for Secretary Shinseki and has been since he joined the administration back in 2009. The reason why I mention that and why I bring that up is because obviously when in this program that the VA is looking at in this effort, there is there's going to be a need to utilize mental health providers and licensed professional counselors, to help a lot of these veterans make that transition from being homeless and living, day to day on the street to getting into places where they can work and understanding and mentally making that adjustment. And I think that that's something that we're going to keep our eye on and be in frequent communication with the VA about to see if there are opportunities in which we could assist in eliminating homelessness among our veterans. An additional $32 million was also allocated within the budget for what the department is referring to as seamless transition. Seamless transition is a process that the Department of Veterans Affairs and the Department of Defense have been working on, and different veteran service organizations have been calling on them to do for a long time, which basically means that having a seamless transition from the point when you are inducted into the service in the armed forces to the point where you are separated from service and become a veteran. For any of you who are veterans or families of veterans or have treated veterans, everybody has a handful of stories at least that they could remember of problems that occur with veterans accessing their benefits and their health care due to the lack of coordination between these two departments on things such as documentation, making sure that medical records make it from one place to another, and that people know what they're treating and what treatment a veteran might have received while they were part of the service, so that they could have a clear picture of how to treat them and develop better methods to treat them when they're in the Veterans Healthcare Program. Part of that money that of what's called seamless transition is being set aside for what the VA calls education counselors, and that's a direct quote from the VA themselves. They keep mentioning this frequently during different times. They keep talking about education counselors and using the word counselors. Now, obviously, that jumps up at us because one of the questions we have for the VA, and we're waiting on our response back from them, is what do you exactly mean by counselors? Because obviously, we have a real big problem right now with the VA not hiring counselors at the rate we believe they should be. And if now you're talking about education counselors, and does that mean that this is a new area where another segment of our membership who may not have been involved with VA may have a new opportunity to contribute their services? We're gonna again talk to the VA about that and see what they mean. Obviously, the president and the first lady and a lot of folks in Congress, as well as the department, are placing a new higher priority on making sure that we're getting veterans jobs when they come back or they separate from service. We want to make sure that those folks are getting in the workforce. But if they're talking about education counselors or even career counselors, we think that, again, that's another part of this overall veteran service plan that we can provide some input to and some assistance. And so we think that if we can get the VA to work with us, that's a natural fit for a lot of our members. The last thing on the VA budget is if you hear any stories about it or you're kind of following it along, you may notice that the budget proposal calls for $54 million in what's referred to as advance appropriations for the 2014 fiscal year, which is obviously the next fiscal year that they'll be going into. And the reason what advance appropriations is basically is it's a very literal term. They are setting aside, they being Congress, are setting aside a pool of money to be used for the veterans' health care services. And the Congress approved advance appropriations back in 2009 as part of an effort, and it was a long, hard-fought battle on behalf of the veterans and their service organizations to get this advanced funding. They were very concerned, they being the veterans, that from year to year, and we've certainly seen this within the last couple of years, that the relationship between the Congress and the President sometimes can get very contentious. The Congress itself can be very divided, and we don't see some things being done that need to be done on a timely basis, some of those things being a budget. And nobody wanted to see the veterans community suffer for lack of a budget or lack of funds being available because they were, the parties in Washington were getting into a fight and couldn't agree on what to do. So one thing that the Congress did agree to do is set aside this advanced amount of money that's there for mental health, for not mental health care only, but all health care for veterans. So as they move from fiscal year to fiscal year, they can at least count on a steady stream of funding that will not end if the Congress fails to pass a budget and the President doesn't sign it. So that's what that $54 million is supposed to be set aside for. Now, obviously, this is all well and good, but we want to make sure that, number one, that the budget that the President is proposing is meeting needs that we feel are going to be met, that they're allocating enough money. We're working with a couple different VSOs on tracking the budget. There was a briefing this morning that the Paralyzed Veterans of America had provided to us and a couple of different organizations about it, and they had shared a couple of their concerns about the budget and making sure that there was enough monies that were going to be set aside for the project. So I won't bore you with the details, but they've stressed their concerns, and we're kind of just watching and making sure that seeing what happens. It's also important to realize throughout all of these budget processes, this is just a proposal that the President puts forward. The Congress itself is going to have hearings. They will appropriate money. They'll have legislation that moves forward that's got to move through the Congress and get signed into law. And what they propose and what they pass are going to probably end up being two different things, and so we'll probably see some wrangling, some more fights on the Hill. And of course, the biggest concern that a lot of people have overall with every piece of the budget is this issue of sequestration. A lot of you all remember that last year we had the debt ceiling vote as part of that agreement with the Republicans and the administration. They decided we're going to go ahead and have this super committee that will find $120 billion in savings, and we can get that we can find or we can get this sorted out if we have these folks sit down together. But if they don't figure it out, we're going to have across-the-board cuts and do what they call sequester or freeze funds so that we can start getting the debt under control. Super committee, of course, failed, so now everybody in the Congress is trying to see what's going on because everybody's got portions of the budget that they'd like to see protected, whether it's Social Security or defense spending or Medicare. There are cuts that people don't want to see happen, and so how that's going to shake out throughout the end of the year is still anybody's guess. In particular, with our programs, VA being one of them, there's a big question mark as to whether or not VA itself will be facing cuts and mandatory cuts. And what does that mean? Does that mean the veterans aren't going to get health care? Does it mean that they're going to have to cut down on delivery of services? Are benefits not going to be paid out? Or are they going to be reduced? All those are a little bit up in the air because the administration has not said with a definitive yes or no whether VA funding is going to be separated out and not touched by sequestration. Are there any questions on the budget stuff, at least with the VA as it stands right now? No?
Mm-mm.
Okay. Moving on from that, we're going to go to just the issues that we've had with VA and kind of keep you updated on the progress of that right now. As some of you have been hearing from the call, and if I've chatted with you offline about this, you know that we're working with several different groups, including AMCA and MBCC and the Marriage and Family Therapist, to meet with a lot of folks in the VA to talk to them about the lack of funding or the lack of hiring of counselors across the board, and talking to them that this is not a isolated issue for one veterans hospital in one region of the country, but it seems to be systematic and across the board, and we want to see how we can get that solved. What we have done, and as you all know, we've decided our kind of loosely fit coalition here is to start seeking some congressional remedy throughout the whole thing, and we're going to be meeting with members of the House Veterans Affairs Committee, the staff members, and talking to them about our concerns. We're going to be meeting with both the majority member staff and the Republican staff and the Democratic staff to start talking to them about our goals and ways that we can start pushing the hiring of counselors and see that become a reality. We've also been reaching out to different veteran service organizations about our issues and asking them for support. The response has been positive because a lot of them are very concerned about the fact that there are unacceptable wait times when a veteran goes into a veterans clinic or a veterans hospital and needs to see somebody for what range of mental health problems, whether it be PSD or issues related to traumatic brain injury. And so we feel that we're going to at least get some headway and hopefully get some answers as to why this isn't occurring and why we feel there's a large segment of the mental health providing population that's not being looked after. As we move on from that, we're going to keep you all updated. If you have stories or concerns about that, please feel free to give me a call. Some of you have called in and shared those stories or emailed those stories, and we thank you for that because what it's showing is it's at least giving us anecdotal evidence to members of Congress that, again, this isn't an isolated incident. This is occurring time and time again, and we need to get this solved. We are also grateful for those stories because we found in some instances veterans are actually, leaving the service, graduating from a counseling program and becoming licensed professional counselors, yet they themselves as a veteran are being shut out of working for the VA, which is what a lot of people are very upset about. So once again, we'll continue to work on that and keep everybody updated on our progress. I would think Scott has signed on right now. Is that right? Are you there, Scott?
Yes.
Okay. I'm going to go ahead and hand it over to you.
Okay.
And then if there's any questions, we'll go ahead and I'll take them at the end of the call.
Thank you, Art, and thank you everyone for bearing with us after we switched the date from Wednesday to today, and for dealing with the fact that we were having technical difficulties at the beginning of the hour. Art's already talked about the VA portion of the President's budget and the fact that this is just a budget request, and so it's simply laying out what the President's priorities are. Congress is going to develop its own budget, which will set the guidelines for the spending decisions that take place later in the year. But this is kind of the first salvo in that whole discussion. With respect to education programs, which we care about very much, there is a request or proposal for an increase of $1.7 billion in discretionary spending for programs in the Department of Education. It constitutes a 2.5% increase. So despite the fact that these are really, really tough budget times and everyone's trying to tighten their belts, the President at least wants to increase spending on education. So that's the good news. The bad news, though, is that as part of that whole process, the administration is once again proposing to consolidate, i.e. eliminate, the elementary and secondary school counseling program. And that's obviously not something that we're happy about. The administration, as it has before, and as it has within the context of reauthorization of the Elementary and Secondary Education Act, would like to combine the elementary and secondary school counseling program and some other programs into one broader grant program. One of the other programs that did not get any money last year, unlike ESSCP, grants for mental health integration in schools, also is once again proposed to be eliminated, and since it didn't get any money last year, it isn't even listed as one of the programs that's getting consolidated in the budget proposal summary that the Department of Education put out. So the trend is still against us, but we will continue to work to try and maintain funding for ESSCP. It's still, I think, pretty unlikely that there will be ESDA reauthorization this year. Each day that goes by, I think it becomes more and more certain that it's not going to happen before the elections, which means that the authorization for the school counseling program and some of these other education programs stay on the books. And we'll be working with our coalition partners to try and make sure that not only does it stand on the books in terms of authorization, but that there's actually some appropriations for it as well. Obviously, the need is out there, so we've got a pretty strong case to make. Let's see, what else? The Rehab Act, because of the statutory funding formula for the state VR grant, gets an increase, as usual, to account for inflation, so that remains safe for the time being. One thing I would point out, though, with respect to the budget overall, is that it would achieve enough deficit savings that it would make it unnecessary for Congress to adopt it for there to be sequestration in January at the end of the year. Obviously, Congress is not going to pass the President's budget, and it's probably not even going to come up for a vote in the Senate. But it does at least manage the numbers in such a way that you would not need to do the sequestration. It remains to be seen how exactly that upper-level discussion gets hashed out, though. The bigger news today than the budget. The budget at this point is kind of old news almost. Is that Congress appears to have reached agreement on extending the payroll tax deduction, or reduction, I should say, that was set to expire at the end of the month, and on extension of unemployment insurance, and importantly for us, on forestalling the scheduled reduction in physician reimbursement rates under Medicare, under what's known as the Sustainable Growth Rate, or SGR. So the SGR fix, as it's called, apparently is going to be part of this package that they agree to and appear to be trying to pass and get on the president's desk within the next few days, so they can get this dealt with, go on recess next week, and have it be done before the February 27th deadline for all this bad stuff to happen. The Medicare SGR fix that's part of the package apparently will resolve the issue for 10 months. So it's not a permanent fix of the physician reimbursement rate under Medicare. It's yet again a temporary fix, and it doesn't even last through the end of the year. So that means that they're going to have to come back before the year ends, either before the elections or in a lame duck session, and deal with this again. The Medicare portion of the package that they have just reached agreement on, our understanding is that it doesn't include hardly anything but the physician payment rate fix, which means that there is not Medicare coverage of counselors included in the package, nor is there hardly anything else that both mental health advocates and other people concerned about the Medicare program wanted to have in there. So if they pass this, which I assume they will, that means we've got a 10-month window of opportunity here to convince members of Congress that the next time they do one of these things, if they're really concerned about access to providers within the Medicare program for beneficiaries, they should include Medicare coverage of LPCs and of MFTs. I've been up on Capitol Hill, I think, so far every day this week in lobbying visits with representatives of the other groups that we're working with on this, NBCC, AAMFT, the California Association for Marriage and Family Therapists, and we're talking to people about the issue, reminding them of all the great policy reasons that they should cover counselors and marriage and family therapists. And as usual, everyone seems to agree with us on the merits of the issue itself, but everyone is still really concerned about money. And even though this has a low price tag, they still don't want to do anything that means they're going to have to raise money elsewhere to cover the costs. So Art and I are going to be working with counselors across the country in certain key states and congressional districts over the coming months to try and see if we can get district office meetings to happen with counselors and with members of Congress or their staffs in the district, get letters from state counseling organizations sent in to members of Congress asking them to support this issue. We really believe that just doing the same thing we've always done is not going to get it done, and that we need a significantly bolstered grassroots presence on this in order to break through the ice. So if you have any interest in helping out on that, or want to know what particular members of Congress or senators we're hitting or targeting, I should say, contact Art. Art is at 800-347-6647, extension 242, and his email address is aterazas, ATERAZVAS, at counseling.org. Did I get that right, Art?
Can someone repeat that?
Yes, you
I
did.
didn't get it.
Can you give it to them, Art?
Sure. It's A as in apple, T as in Thomas, E as in eagle, RRAZ, as in zebra, AS, @counseling.org.
I should have had it in front of me when I said that instead of.
No, it's okay.
So anyway, we brought Art on staff specifically to help us develop our grassroots and help counselors be effective advocates with congressional offices. So if you have any questions about how to do that, please feel free to contact Art. In the meantime, while the Medicare issue is resolved temporarily and we're trying to increase grassroots pressure, realistically, given the fact that Congress usually doesn't reach any decisions or hammer out any compromises until they absolutely have to, we have heard that there's a chance, perhaps, that there will be some work done on reauthorization of WIA and the Rehabilitation Act, and we'll hopefully be working with NCDA and with ARCA on proposals to reauthorize those programs. Reauthorization is way, way, way overdue, and in this environment, it's been very, very tough to get anything to happen. So it's I'm still skeptical that reauthorization will happen, but there could be some movement on legislation which sets the groundwork for stuff to happen in the next Congress. And sometimes you never know when the ice breaks, to keep using that analogy. So they may get to a point in the schedule where not much else is happening and they want to get something done and prove that they're not a dysfunctional Congress, and legislation could start moving. So we'll try and keep tabs on that. So with that, I think I will open it up for Q&A for people and see if anyone has any comments, questions, etc.
This is Janetta Edwards. I'm from Governor State University. Dr. Snow is our professor, and she was so kind to give us this information for us to get on today. My question is, and future counselors, what can we do to kind of help move this forward for you on the ground level? What can we do?
I'm sorry, I had a hard time hearing that. What can you do to help on what?
What can we do at the ground level to kind of help you guys get some things done? Is there phone calls we can make? Are there letters we can write? What can we do?
Yes, and yes. Basically, what we need is honest-to-God, individualized contacts coming into members of Congress on a specific issue with a specific request. And just to use Medicare as an example, what that would mean is a call or an email, or better yet, a visit to the local office asking your senator to co-sponsor S604. That's the bill number for the Seniors Mental Health Access Improvement Act, which would cover counselors.
Can you repeat that bill again, please?
S604.
Okay.
And if you ask your senator to do that, you're asking him for a specific action, and you can follow up and find out 2, 3, 4 weeks later whether or not they actually did that. You can hold them accountable on that.
Okay.
The more senators we have co-sponsoring that bill, the better our chances of getting it included in the next round of Medicare legislation that goes through. If we had 80 senators co-sponsoring that, this might even be part of what they hammer out here this week.
Okay.
And one of the words that I used in describing that kind of contact was individualized, and that just means it's got to be in your own words. And that doesn't mean you need to write a 2, 3, 4-page letter. And in fact, you should not write a 2, 3, 4-page letter or email. You can send a very short email, have a very short, concise phone call into the office, but what we want to stay away from are form letters and form emails. Those don't work. Those just irritate them, really, more than anything else. So just spend a couple minutes learning the issue, which isn't that tough, and we've tried to help you do that through our web pages. And if you have any questions, feel free to give us a call or shoot us an email if anything's not clear. And then whatever's easiest for you, call, email, send a postal letter to the member of Congress asking them to take specific action. And ideally, don't make that be your only effort. Follow up after that, 2 weeks, 3 weeks, 4 weeks later.
And if you that's number one. Let me thank you for your question, because that's what we need to hear more from counselors is how can we get in there and move the ball down the court. And if you have additional questions, and if you're going to be calling in, please also drop me an email or give me a call. That way we can keep tabs on who's being contacted, and we'll be able to just keep that coordinated within our offices. And if you want to talk more about what other activities you can do, feel free to call me. Like Scott said, that's what I'm here for. And I'm more than happy to talk to you all about that.
Thank you.
No, thank you.
And I will share it with some of my classmates who may not have been on the call today.
Thank you. Thank you.
Scott, feel great.
Yeah.
Just two things. One is I really want to express appreciation to you and Art for this coalition work. I think it's so essential in the tough times we're experiencing.
Definitely, yes.
And the question is, have you had any time to make any plans for PPL meetings in San Francisco to enter conference?
No, and actually that's something that you and I should talk about here soon, obviously. Okay. I can't remember what day the meeting is. I want to say Friday, but I'll have to verify that. Okay. So yes, let's talk about that. I have reached out to the region chairs to talk to them about the possibility of coming by the region meetings and talking to them briefly about what we're hoping to do over the coming year. Yeah, I've still got some preparation to do for conference, I have to say.
Okay. Looks like made a lot of good progress. These top topics.
Hope so.
Thanks so much.
Sure. Anyone else?
Scott and Art, this is Cindy from Louisiana, and I have actually 3 questions, so I'll be very brief. Do we have any idea the number of KCREP LPCs that have applied at the VA? And if not that many, then do you think the VA would reconsider their hiring criteria? And along that same vein, if the veterans who are becoming counselors are not able to be employed at the VA, do you think there's a chance that we could maybe have a collaboration with them to get that changed? And then thirdly, and I apologize for this, who is contacting the VA to maybe address the errors of their ways?
Let me go back to the first question. You kind of dropped out there. Can you repeat that? The first one was about KCREP accredited graduates.
Right. How many KCREP LPCs have applied at the VA? And if not that many, then I wonder, would the VA consider changing their hiring criteria?
We don't have any idea how many counselors who graduated from the KCREP program have applied. We do know, because we've been keeping tabs on it, that very few counselors have been getting VA positions. The VA facilities are continuing to hire predominantly social workers, so that has not changed yet. Art is taking the lead on the VA issues for us, so I'll let him talk about the work we've been doing?
Well, and then to go back and kind of piggyback what Scott said, and to answer your question, we know that it's not a lot because the VA has that KCREP requirement across the board. In the meeting this morning, we were actually talking about this with TVA, and they in turn had a meeting with the White House staff, and there is a problem not just with our accreditation, but also with veterans seeking employment across the board with different things. One of the examples they gave is that you've got a veteran that was or you've got a veteran who was a Navy corpsman or a field medic in the service, and they can't even get certified to be an EMT, and you would think that was an easy transition for them to make, but there's licensing problems that occur from one field to the civilian field to the other. We don't think that right now, at least not this calendar year, that that the VA is really going to budge on their accreditation issue with KCREP. It's just that they've got a lot of issues that they're getting hammered for, and that's one of them. And I think that from their standpoint, they know that that's something that not a lot of people are going to push them to change at this point. To answer the last question about who do we, really push that, I think that's part of our efforts of meeting with the congressional staff, because that congressional staff, the Congress, this is not an issue where we need a new law because we already have a law that's on the books. It's an implementation and it's an oversight issue basically for the Congress of telling them, we need to look at, number one, getting counselors hired, because whether they're KCREP accredited or whether they're not, we don't even have counselors getting hired, period. And we need to see that happening in the VA. And part of our efforts are going to be, requesting that Congress submit some questions to the VA. And there's a list of questions that we've always had that have not been answered to our satisfaction to the VA or have not been answered at all. We're going to ask Congress to get some information from the VA so we can have a clear picture of how to get from point A to point B, because we know what the answer to our problem is that we need counselors in the VA, but how do we solve that is a different question, and that's why we want more information from the VA. We want to know is when the VA says we have 20,000 plus mental health providers, well, where are they? Who are they? Are they social workers, or are they psychiatrists or psychologists? What does that picture look like? I can tell you that we can work with folks that are counselors and are vets. We want to work with them and have them reaching out to their members and their senators, just like we're doing on the Medicare issue. But we've also got some support from folks within the veterans community, because they're upset with the wait times itself, and they're tired. And when they go to a committee hearing and the VA says, well, we have staffing issues, we need to hire more staff, but we'll get on it. And the vets are saying, you keep hiring more staff, I still need a wait time. And then we tell them, well, you're separating 40,000 or 40% of the population out. That all lines up to saying that for people saying you need to hire more counselors, and so we're getting some support on that.
Thank you.
And I think that Gila was doing some research, and he said that I think in the last 3 weeks, if you go to USA Jobs, you only find about 3 positions open for counselors, as opposed to 166 positions listed for social workers. And so that right there is clear evidence that something needs to change, and that's what we're going to be talking to the Senate staff, the committee staff in both the House and the Senate.
This is Pat Schwally-Gittis. I'm delighted to hear you say that you're going to follow up with them, and I think that one of the things that we can do is certainly help them understand what counseling includes, which also is career counseling, and we might tie this in a little bit closer with what they're referring to as educational counselors, because I think basically they're talking about career counselors. They just don't know the language that we use. But I certainly would love to see us move forward with more dialogue with them and helping them understand that we have a lot of people that are trained specifically to help returning vets, not only with mental health issues, but issues of about jobs.
You're absolutely correct. We see the employment rate right now for veterans is somewhere between, and it goes back and forth, but it's a little bit of between 15 to 16% of the population. And the biggest problem that they have is that, especially with younger veterans, because a couple of years ago they said that one of the demographics for the biggest growing segment, I should say, of the homeless veterans population, and that they expected to grow, this is back in 2009, were women veterans with children, that were single moms that were vets with kids. And you can just imagine how big of a toll that takes, not only obviously on those individual families, but on the rest of us as a whole. But when I was working on veterans issues in the Congress, and we were talking to different veterans, I remember I was speaking to one veteran who's a retired colonel, and I said, we need a lot of education programs and employment programs for veterans. And they said, well, we don't. And they kept asking me, he and this other group I was meeting with said, why is that such a problem? Why is a soldier coming back such a problem? Because from his perspective, he saw a soldier that was trained with a useful skill or several different skills, and was trained to follow orders and do a job exactly the way they were told. And I said, well, you think about it, there are other skills that soldier, sailor, marine, or airman don't necessarily do when they're getting out. We're seeing a lot of young men and women coming into the service immediately after they graduate high school. When they come out of the service, they don't know how to write a resume, they don't know where to look for a job, they don't know where to look for housing. Those are all different things that we and our members can help out on. And if we're not providing those services and nobody's doing that, then we can create all the programs saying or bills saying you have to hire 5% of veterans in your workforce, or have those 5% set aside. But if the veterans themselves don't have the skills to go look for a job, they're not going to find that job. So that's again a niche that we think we can fulfill pretty succinct, or not pretty succinct, but pretty
absolutely.
Have an expert take on that.
Hello?
Yes.
This is Lamar calling from New Mexico.
Yeah.
So I am a 20-year veteran of the Air Force, independently licensed and all that. So who specifically can I, also a specialist in post-traumatic stress, so who specifically can I and a few other people I know who have my background and who have spent a considerable amount of time in the military, who should we contact directly?
To do exactly what? I'm sorry, I don't think I understand the question.
To emphasize how, military members are a lot like law enforcement. We're more comfortable with people who have a military background, people who understand the language, people who understand what it means to be deployed, and so forth. So therefore, it would be a huge benefit, obviously, to hire counselors who are veterans and so forth. So who should we try to speak to or speak for, the counselors who are veterans or who has the military background?
Well, I would say that there's a couple different things that we'd ask you to do. Number one, if Lamar, if you can give me a call after this is over, whether it's today or even tomorrow or next week, but if you can give me a call so we can chat one-on-one, because I'd like to talk to you just a little bit more about your experience. But I think that in any instance, because one of the things we keep hearing from the VA is that the central office in D.C. keeps saying we can't tell the local folks what to do. And so what I would say is that there's several groups I think you should talk to. I think that you all should reach out to George Marnell's office there in Albuquerque, because he's the one that directs the health care, all the VA medical centers for Albuquerque, for the state of New Mexico. They all report to him, and he's the head honcho there. But you can call his office and talk to him about the fact that you've got veteran counselors that need to be that want to work with veterans, and we can help folks out. And and just start making some headway there. And then I would suggest that you give a call to your congressman's office, Martin Heinrich, if you're in Albuquerque, Ben Ray Lujan if you're up in the north, or Steve Pierce in the south, and talk to them about this and express your your frustration if you've been trying to get in, or your willingness to help. And I'd also contact Senator Udall's office out there. Because that's the way again that we start making an impact. Is when the congressional offices are going to start hearing about this, and also if you're contacting the local folks, at least we can also say to that VA Central office that our counselors are contacting their local hospitals and telling them that they want to do this. So we want to make sure that from our end we're talking to as many people as we can, because we have to make sure that they start hiring us.
Sounds good. I'll give you a call.
All right. Thank you.
Hi.
Sure. Hi. Do you have a question?
Oh, I was joining the call.
Oh, okay.
It's a call from 2 to 3?
Yes.
Okay.
This is Janetta Edwards from Chicago again. I have a question.
Okay.
What are we doing about the veterans' families? I know we have to help the veterans, but if the veteran's home life is not stable, then us helping that veteran and the home life is out of sync, that's not helping completely. What about their children? What about the wives and the husbands, the ones who are also suffering because of the husband and wife come home and they've been deployed and they've seen some things and experienced some things, and they're not the same person? Do we have something that helps and address the entire family?
Art, you can correct me if I'm wrong, because he knows he's been doing more work on the VEX issues than I have. But what I would say is that we've established some good contacts with VSOs and have been given the opportunity to provide input to the VSOs on the development of things like the independent budget that they put together each year to address some of the broader issues. But unfortunately, we've had such a tough road to hoe to get the VA to hire people. Now it's more than 5 years since Congress enacted legislation to establish recognition of LPCs as mental health counselors within the VA. It's been like pulling teeth, unfortunately, to get counselors hired. We've tried to stay focused on doing whatever we can to move the ball forward on that issue before starting to take on some of the broader issues. Art, do you have anything to add to that?
Well, I would number one recommend if anybody ever encounters a situation where you find out that there's a veteran either that you know or somebody who's seen you as a veteran, or somebody who's got a family, always kind of do I always recommend people to make sure they're utilizing their local vet centers. Vet centers are set up across the country. There's about 300 of them nationwide. There may not be one locally, but there may be one locally. And the nice thing about a vet center is the family can actually go into the vet center and utilize those vet centers programs as well as a veteran. The vet centers are set up primarily for combat veterans, but they can always either help you there directly, or they can refer you to maybe a local group or local nonprofit that's doing some work in the areas, because I think that's a very important thing not to forget about. Like you said, that the husbands, wives, parents, children are all affected, and they deploy when the veteran, when the service member deploys, and there's a lot of issues that they're going to face, a lot of challenges that we as a society need to be there to help them out with. So I would always say, number one, the vet centers are something that are a good place to start with. Now, unfortunately, through the VA, separately as a hospital and a clinic, those services are specifically set aside for the veteran themselves. They don't. Sometimes they don't typically have services for the family members unless in certain cases of eligibility, which you have to qualify for a couple of different things for that. But if they're and then sometimes if they have TRICARE for life, there might be a way that they could qualify for some of those things, but it gets a little murky as you get out there. One web page I want to just put out there, because we had a veteran actually who was on one of these calls a few months ago that recommended this, is if you have, there's a kind of a clearinghouse that can help with that. It's militaryonesource.com. If you do a Google search for that, it'll come up, but it's Military One, and one is spelled out. Source. That's actually militaryonesource.mil. That's the website.
No, sir, it is .com.
Excuse me?
It is .com.
Okay, yeah, I'm getting two different ones, but militaryonesource.com. That's another one. And there's another one that the VA has started to help folks out, specifically this is for the veterans, but it actually is kind of multifaceted for veterans and veterans' families, and it's called maketheconnection.net. And this is something that they rolled out within the last few months. This has helped to help kind of network people, veterans that are having some problems, and also family members, and they've set it up so it's supposed to be much more user friendly for veterans that have served in certain time frames, and that are male and female, whatever they served on in their service branch.
So this is Cindy. I'm the Director of Psychological Health for the National Guard in Louisiana. Would it be helpful if I sent you guys like a list of all my resources? I have just pages and pages of resources for mental health professionals that work with veterans, and I'd be glad to share that.
That'd be great, because I think we might have sent that before, but I think we probably have some new folks. So if you could shoot that over to me,
okay,
and then I can just send it out again, and because that's always helpful. And our National Guard, back home in New Mexico, does a really great job with that, and you all do a wonderful job, especially with the families when they're deployed. So,
thank you.
Well,
I'm sorry. When will you all be doing this again, the phone conferences again?
I suspect we'll probably do it the week before conference, probably 3-4 weeks. We'll send out a notice and post something on the web page, and probably include it in e-news as well.
Can you give us the web page again?
Excuse me?
Can you give us the website again?
Sure. www.counseling.org/public policy, all one word.
Okay, thank you.
Sure. Since it's 3 o'clock, why don't we wrap up? But as usual, if you have questions or comments that you didn't get a chance to ask, or something occurs to you, or whatever, feel free to call or email Art or myself. Art's given his email address. Mine is sbarstow, SBARSTOW, @counseling.org. And the phone number, once again, is 800-347-6647. I'm at extension 234, and Art is at extension 242. And thank you very much for joining us.
Thank you, guys.